introduce myself again.
Okay, and then of course at the extreme left you have Dr. Kenneth Okware. He's a psychiatrist and senior medical officer in mental health division of the Ministry of Health. Doctor, it's a pleasure having you this evening as well.
Thank you, and thanks for hosting me. Yes.
We are delighted. Evelyn, just to ask you about, first of all, Therapy Counseling Foundation. What do you do? What is it about? Because when we hear therapy, I mean, our minds run to very many things.
Okay.
Yes.
This is a psychological firm, and it is there to offer private, for those who look for, private practitioners, in counseling. So they book appointments via website, and we do so many things. We do family life counseling, relationships, and many other, stress management, school counseling, and many other psychological issues, and psychological assessments.
Okay.
Yes.
So we know that I asked you that because I wanted to get the entire block of what you do, and so that is Evelyn, and of course we have Doctor. Starting up with our discussion today, we have two phrases that we commonly use: mental health and mental illness.
Yeah.
And to us, the lay people, we do not differentiate the two.
Yeah.
So we do not know when to say mental health and when to say mental illness. So can you please differentiate the two for us?
Okay, thank you. Mental, WHO defines, and we also use that definition, defines mental health as the state of well-being in which an individual is able to cope with day-to-day stresses of life, know their abilities, what they are able to do, work productively and fruitfully, make meaningful relationships, and contribute to his or her society. With that definition, you note that it's quite simple, that basically what it tells us, it's that ability we need to be able to do what we're supposed to do, to know who we are, what we're able to do, and do what we are supposed to do on a day-to-day basis. So that is as simple as mental health. So with that definition, you note that everyone needs mental health in order to survive, or in order to live, and in order to thrive in society. On the other hand, we have mental illness. So mental illness has the word illness in it. So some people use the word disorder synonymously as a collection of illnesses that affect the brain. So mental illness, just like any other illness, a set of conditions that affect the brain. Okay? And because it affects the brain, it will affect the way we think, it will affect the way we feel, and the way we behave and interact with others in society. So that means once someone has a mental illness, it is shown, or it manifests through the way they feel, their feelings, or their emotions. It also manifests the way they interact with people in society, because people can observe behavior and note that that behavior is not usual, because that's what they see, and can also affect the way people communicate or talk and speak to others, just because it affects the brain. Of course, mental illnesses are common. Global statistics say it affects 1 in 5, and in other statistics they say 1 in 4 in a lifetime. That means if you look at how many people here, or if we are 5, one of us will have some form of mental illness in our lifetime. It's important to note that mental illness, as much as they affect an individual, okay, the burden extends beyond the individual, because the person suffering, the burden is huge. It restrains their ability to survive and thrive. It also restrains their ability to realize their potential and become who they are. And unfortunately, because of those abilities, because of the distress and the silent suffering they go through, they sometimes are taken advantage of in communities. So people with mental illnesses often present with unique vulnerabilities because they may not interact with people, interact with society, the full range of people, they say. What I'm trying to say is that the people, the sufferers of mental illness, face significant distress, and because of that distress, they are unable to do so many things in life. And because of that as well, they are often stigmatized in society, and that affects their ability to seek help. Unfortunately, because of the many signs and symptoms of mental illnesses, they have different interpretations, and society may interpret it differently. Sometimes they may say that it's personal weakness, depending on the type of mental illness. They say that one is weak, or maybe allows to be stressed by certain situations or circumstances. Others, they may say they are possessed, if the symptoms of the mental illness comes with, abnormal or aggressive behaviors of talkativeness. Others, they say it's a curse. Others, they say it is some form of witchcraft, and so on and so forth. Yes, so depending on the alternative explanation that is attached to the particular symptom of mental illness, it will determine where these people seek help first. So many times people with mental ill health may not necessarily seek help or care in our health facilities. Unfortunately, they go to alternative practices depending on the explanation in that community or society. And that's why we need to raise awareness and let people know that mental illnesses are common. The commonest mental illnesses, unfortunately, again, because of the stigma and the myths attached with mental ill health, people think that the people only who are mentally ill are those that move in the streets, those that maybe are walking around, talking to themselves, hearing voices of people talking to them, people that they cannot see, probably, are quite aggressive or talking too much, and so on and so forth. But that is the small number, the smallest number. It's estimated that carries around 0.5 to 2% of the population. The majority of people with mental illnesses have emotional problems. They suffer things like depression that presents with persistent sadness and loss of interest in the things that normally make people happy. Others present with anxiety, excessive worry about day-to-day problems of life. And people get so worried that they have trouble sleeping, they cannot eat, they cannot settle still, they are restless, and so on and so forth. Panic. All of a sudden, people are overwhelmed or consumed with excessive fear, and that will affect the way they run their day-to-day lives. Alcohol and substance use, these are silent mental ill health issues. Addiction is a mental illness, because the people who are actually addicted do not want to be. They drink or take the substance in order to feel normal, because they've taken the alcohol substance for a long time. Their brain has reset, and it has created a new norm that without the alcohol substance they don't feel normal. So if you see them having behaviors of looking for this substance all the time, it's an illness. And for as long as you cannot control a behavior that you yourself know is bad, that means the brain has a problem. And usually it is a mental illness. So these are the most common issues that we want to talk about. And you may ask, what causes these things, or what are they linked to?
It was what I was going to ask actually, Evelyn, because we realize the numbers are increasing of late, unlike the previous statistics. Now, why are we seeing that some of these cases are on the rise?
Just from picking up from doctors' explanation, the causes of mental health are many. As much as we have genetic factors, but even the lifestyles that we live, not working on our issues early in life. Like doctors say that people who are already sick, who have mental disorders, people are able to identify them and say, this person is out of order. But me, who is having sort of functional depression, I'm able to come here and work and do everything. By the time you see that I'm getting out of hand, it's usually too late. So the causes are both social, they are psychological, and the genetic factors are even easier to manage, because then the person might know that in our family this is what we are. But then the usual stressors that we go through and do not attend to them on time are the ones that keep making us go down the trend. For example, many Ugandans are not sleeping. Most people, or most of us, are sleeping for about 3 hours in the night, 2 hours. We're working so hard to make ends meet, and we do not stop to take a break. It's only during COVID that people took a break by force. It was a forced break, boring. And it became now boring. Yeah. So if we do not attend to our daily life issues, that starts slowly and creep into mental health disorders, and people begin coping with alcohol. You have pressure at the workplace, but instead of attending to what is causing this pressure, someone resorts to taking drugs or taking alcohol so that they can manage the pressure, and at the end of the day it becomes an addiction, and then we have someone having a mental health disorder. So if we could be having mostly, knowing that they are mostly genetic, but even some of them are personality and then behavioral caused, and then not attending to our issues faster when we get them, or not having most of us are not having a health-seeking behavior. So in most cases, when someone is going down, usually they will turn to other alternatives. Church is very good. One psychiatrist told us that most of the clients who are having anxiety are found in church, because people will only go to church and stay there. The pastor may not even know that I'm dealing with someone who is really having a mental health issue until they break down completely. Yeah, so those are some of the things that are leading us into mental health issues, common mental health issues such as depression and anxiety.
Okay. Yes, Dr. Kenneth.
Yes, I just want to make a rejoinder to what she said. So she's basically saying that there are lots of stressful factors as well, and there are many causes of mental ill health, because some of them are beyond us, that people may be born with a genetic vulnerability, that is transferred, and that can increase your likelihood of getting mental illnesses. But also there are psychological factors, the way people interpret or see the world, which is also basically shaped in the environment that raised us, and sometimes contributed by the genes that we carry as well. That said, I want to focus also on the many causes that she says, but would cause environmental factors, what we call stressful factors, because we've noted that mental illnesses are increasing, as you rightly put, and people say, I'm stressed all the time, these things are there. So what
Sometimes
is...
it sounds normal.
Yes, so what is stress? Okay, so stress basically is that feeling of being overwhelmed, okay? When the demands you have on you outweigh your resources to meet these demands that you have on you. So you as an individual, there's so many demands that you have on a daily. You are father, you are someone's son somewhere, you are husband, you are an employee, you are a student, you have rent to pay, there's so many things. All these are demands, okay? Sometimes we do not have the resources to meet all these demands that we have around us. And by resources, because resources can be financial, that you don't have money to pay school fees and do all these things, you struggle, okay? These resources can be emotional, like you do not have the emotional capacity to handle all the things that are happening around you, okay? Sometimes can be physical resources. You're overloaded at work, and there's too much, and physically you are strained. So when there is that imbalance, when the demands are higher than your ability to meet the demands, we say you are stressed.
Doctor, let's take a short commercial break. When we return, we are going to pick it up from there. Kindly stick with us. This is very, very serious. So don't go anywhere. Self-care in mental health. And before the break, we had gotten into something very, very sensitive that sometimes we seem to have normalized, where people will even say, "Tonkuba stresses," and I mean, it sounds a little normal, yet so dangerous, especially to our health. Now, just to remind you, you can be part of this conversation through our social media platforms, but also send your question or your comment on our number 0787 447684. 0787 447684. Do not call, just send a WhatsApp or a text message. It will be responded to in the course. Now, I read you this number now because you can send your concern right now. Don't wait when we close. But Doctor, before the break, you were actually helping us link this pressure to now our mental health. Yes, and let us pick it up from there.
Yes, I defined stress as the imbalance between the demands on us and our abilities to meet the demands. So that struggle we generally have to meet the demands, the overwhelming demands we have on us. is what constitutes stress, and it has a very bad feeling on us, an uneasy feeling. Now, you may wonder, how do I link stress with mental illness?
Yes.
Okay, mental health and mental illness fall on a spectrum. That every day our strive is to be mentally healthy. And remember that the definition of mental health is the ability to know your abilities, cope with day-to-day stresses of life, work productively and fruitfully, make meaningful relationships, and contribute to society. That is our aspiration. So you want to do all those things. But when stresses come along the way, they push you away from that ability, and they give you some uneasiness in feeling. So you get stressed. When the stress is too much, you become distressed. So distress is basically excessive stress. If stress continues to be there for a long time and you do not deal with it or cope properly or manage it well, you can end up with mental illness. And the common mental illnesses that are linked with stress is depression, anxiety, alcohol, and substance use problems that I mentioned. Okay, so in between here, you can say you have mental health issues. Yes, and you as you move, the stress becomes too much, the demand on you becomes too much, the pressure on you becomes too much. You do not do things, and I think that's the principal reason we are here. We want to tell people the things we are going to do to manage these pressures, because as day goes by, the pressures in life become too much. Poverty is higher, unemployment is here and there, the population is increasing, we are having the same resources, so the struggle increases every day to meet our day-to-day demands, what you'd call basic needs. It's not as obvious to live and survive. So the art of staying mentally healthy is an active process. So we seek mental health. It is pursued. You don't sit there and become mentally healthy in a situation where it is hard to secure basic needs, where you need to struggle. So our main purpose here is today is to highlight some of the strategies that people can use. One, first of all, how they can identify the common signs and symptoms of stress and distress, and what may show that you're tending towards mental ill health, and then what strategies can they put across to handle these circumstances, to stay afloat, to stay mentally healthy despite the stresses around, that regardless we move, as the young people say. So for me, that's where I want to
thank you
turn
so much, Dr. Connie.
Yes,
Picking it up from there, what Dr. Closed with, how do I know that I might be mentally ill?
Okay, I'll start on this note that how can you know that you are stressed before we go? Because when someone has a disorder, to be honest, they will not know that they are ill. It's other people who might know. But we as human beings, and being that we're on a Christian TV, I can use the word that God created in us sort of an alarm that looks like things are not going well with you. So sometimes you could have been a healthy person, then with time you realize you get physical signs like constant headaches. These headaches that do not go, and they're not, when you go to doctors, they're telling you they're not finding the connection, and then they are constant. Sometimes you get digestive problems, this fatigue that is unexplained, not because you've overworked, but you feel like you're tired most of the time, you're bored, and so on. But also emotionally, there is this looming sadness. That is not the other total sadness, but then somehow you're not happy, and then you're worried. Anxiety is one of the common signs of this worry that is unending. You're worried about money, or worried about a report, worried about this, and so on. The worries keep increasing without you even getting a solution, and your thoughts keep into the negative side. Life is just negative most of the time, and sometimes you even move to extremes that are behavioral, and other people tend to begin to notice that you start withdrawing from maybe friends, wanting to be on your own most of the time. And generally speaking, maybe if you're a person working in a corporate organization, you start making mistakes, constant mistakes, and everyone is wondering what's happening. You start coming late to work, wanting not to, absenteeism. But also, if you have a family, somehow you realize you're more irritable than usual. Small things spark you off. So those are it's like signs to show you that it looks like things are not working well. And sometimes people are able to notice, but do nothing about it until this goes out of hand. Yeah, for some people, it's other people begin saying that these days you look like you've changed, and maybe they can even become more irritable. So when other people begin even telling you that we don't understand you, then it's also showing that you're into the extremes. But small signs when they start, you're not sleeping, you go to bed, you're tossing here and there, sleep is not coming, you're loaded with thoughts. It's good to begin to know that I think I'm not well. The stress is moving into chronic stress, and I'm not having peace of mind at all. Okay. Yeah, so those are just some of the few signs for starters to show that things are not working well. Yes.
Red flags.
Red flags, yes.
Okay. Thank you so much, Connie. Now we want to get into something very, very important. That is, what do I have to do? How do I manage this? Dr. Kenneth, when I realize that I see a red flags, what do I do? Okay. Connie, let us start from there. What do I do when I see the red flags that you have just talked about?
Okay. They say that, health begins with you as an individual. There are things that you have to do for yourself. For starters, it's good to have a self-care strategy. And the beauty about these self-care strategies are, these are activities that help to maintain and help you to have good health, both mental health and physical health. And these are things that are not bought off the counter, because sometimes people say, self-care is very expensive, because when you talk about self-care strategies, people are thinking about only maybe going to the gym where you pay for a month 300,000, or maybe eating well, eating chips. But these are the simplest activities that each one of us, whether rich or poor, middle income, can afford. And they are the ones that can help us to start to reduce on the, reduce on some of these stressors. Because I want to also say that, of course, some little stress in life is normal, because that's why my World Health Organization says no more stressors of life, meaning that we have the ability to cope with some of the things, and some of them motivate us to work. But when it goes out of hand, so some of the things that we do is, one, start with at least your own physical self-care. Taking care of your physical self-care has a lot of components under it. This has to do with doing a bit of exercise that you can afford to do. If I can't afford to go to a gym, I can afford to put on shoes and I walk for 30 minutes. I can stretch at least every morning to move the body, because some people sit in office most of the time, from office to bed, bed to office, and we start getting issues with weight, overweight, and so on until we get sick. And also, how about diet? Eating rightly. That is also, for starters, good for our mental health, because the brain also feeds from what we eat. If your foods are only they're called fast foods? Fast foods, most of the time you're not eating a balanced diet. Someone will say, how does that have to do with my mental health? It has a lot to do with our mental health, because then we will become unhealthy and start getting worried. Because if they tell me that I have high blood pressure, that is going to be a cause of stress. How about, participating in activities that are fun activities? Have some life outside work. sometimes we work so much and we forget all about our lives, that we have a life, you know. So it's good also to mix fun in our daily life, drinking enough water. These are simple things. I know that someone ever told me that they don't like water. Instead of taking water, they would rather take soda. But water has its own importance in our bodies, and also getting enough rest. Doctors tell us to aim for 7 to 8 or even 9 hours. But truthfully, one time I was speaking to students at the university, and when I talked about these hours, they all burst out and laughed because they said that is not possible. And when I asked how much time do you sleep, most of them said at least 3 hours or 4 hours. And you rightly asked us here that why is that we have increasing mental health issues currently? That is one of the causes. We are not sleeping enough, and therefore people are irritable, people are not, we create accidents, unnecessary accidents on the roads and even at home. And also avoiding or taking less alcoholic substances, because sometimes these are things that increase our mental health issues. Instead of taking alcohol, if you're taking it as, there are people who take it as a social, I don't know, social drinking, but there are people who are problem drinking, like someone is drinking so that they can avoid thinking about problems. Unfortunately, after taking, they feel better for some time, then the following morning they wake up to the same problem. And especially when you're having some stress, it's even good not to use alcohol at all, because the brain works better when it is led or it's spoken to. But if you do not allow yourself to face these issues, then you will not do anything. Also, it's good to set realistic expectations, knowing our abilities, knowing our limits, and saying no to what we cannot do, beyond what we cannot do, is very important. Most of us do not have boundaries. We take in every job, everything that we are given. We please people, say that because if I don't do this, my mom will feel bad. I have to do all these things, until you end up breaking down. Socially, to have a good mental health and to reduce on stress, we are created for connections. So if your social life is poor, in most cases you'll have increased chances of having stress, because you feel disconnected to family, disconnected to people. So it's good to have a social connection so that you can be able to share your feelings to individuals and even people who love you. I think one of my clients I had a few weeks ago had issues with everybody. She felt she hates her parents. She hates her parents-in-law. She hates her husband. She hates until I said, okay, now this is beyond repair. We need to go back. What is happening to this person? So by the time you reach there and you hate everybody, your stress levels will go too high. But also learning to seek support when it's so early. They say that, for example, in therapy, counseling is very good and helps people who come early. But because that's like at the primary of care level, the starter, you know, to help you not to go beyond this, what doctor talked about. You end up going in the red, and you end up going for more expensive interventions. So it's good to seek for therapy or counseling before the problem goes higher. But also there are other easy techniques like muscle relaxation, stretching a bit once in a while, deep breathing, meditations. I love the Indians. They have a very good strategy, which we Africans have failed to learn. They do meditate. You know, they have time to, push out things, and they just go into themselves. So many times we have too much attention for noise outside. We want to know about Trump, know about everything. Iran and Israel, like we are overloaded with over information. And we also add on to our daily life. And too much social media, reduce on the time that you spend on the screen, especially for young people. They sleep with their phones in their rooms, and therefore they're not sleeping. Every time they're receiving messages, it increases on your tension. You read your emails even unnecessarily if you're working in an organization which is so much having a lot of work. You read an email at 10 p.m., then you realize you have to open your laptop and reply. So it's good to know that, no, now at past 10, I'm not able to open my laptop, I'm going to open my phone. And these are things no one else will do for you. Like, you must have your own boundaries, and other people will respect. The moment we show people that, for me, I'm available. For him, if he's not going to do it, me, I'm there. And people will always give you the work to do until you break down. But also, spiritually, self-care is like physical, emotional, social, but also spiritual. Having a good connection with your higher power, that feeling that I'm well connected, is also important. If this is what works for you, you're a person who loves going for prayers, please do it, because it's part of self-care. You go to church, sing, come back feeling much better than you were. And so sometimes people get stressed, because as a counselor, you receive people who have stress because of church, having a feeling that now my pastor does not love me, now all these things. So also take care of yourself spiritually and find comfort in those prayers. But the emphasis is seek help when it's still early. And also, especially, there are times whereby these resources at some point might not be enough, especially when you now into stress and depression. It may not go away even when you do these things, and at that level you need to see a professional. Yeah, maybe doctor can add some more things.
Yes, I just want to thank Evelyn for highlighting all the strategies that we must emphasize or put in place to stay mentally healthy despite the stressful circumstances. I just want to supplement on some of the points Evelyn mentioned and emphasize things like exercise and diet. The brain produces many chemicals or hormones. There are certain hormones that are responsible for our happiness. And when they are produced, we become happy. And when you are not happy for a long time, they go down. Sometimes when people are depressed or anxious, the medicines we give them to raise those happy hormones, and that's the treatment for depression and anxiety. So you shouldn't wait for them to go down so that you will give you pills and therapy in order to raise them. Things like exercise, they are natural stimulants of the happy hormones. So other than just keeping you healthy, they also raise the happy hormones and they make you feel happy. Diet is also very good. It's important that we watch our diet. There are certain diets that are precursors of they help the manufacture of those happy hormones, and then they help us. But vitamins and all this, so it's very important that we watch our diet. But also you need to stay healthy, because if stress gets a body that is not very healthy, chances of surviving are less than the person who was healthy physically. So it's very important. Being purposing to do activities that bring you happiness is also key. Sometimes in these very hard circumstances and situations we undergo, it is very easy to get overwhelmed with work. It's very easy to be overwhelmed trying to be a good husband, trying to be a good wife, trying to be a good parent. But if you get soaked and the whole week, the whole month, everything goes, and you are not deliberate in the activities that bring happiness to you. And there are so many safe activities that bring happiness to people. You must do that, because if you do not do that for a long time, the happy hormones go down. Every time you do an activity, other people love watching football, other people love traveling, other people love reading. You take some time off your busy schedule, of being a husband, of being a wife, of being a parent, of being an employee. Take some time and do the activities that will stimulate these happy hormones to go up. And once that happens, you feel happy and you're protected from the stressful circumstances. That's why I say that it's deliberate efforts that people should put in place. I think she also mentioned avoiding alcohol and substances. You see, every time we are very stressed, the brain is vulnerable. and it's looking for anything that will elevate some of those hormones. Now, alcohol and these substances have a way of temporarily raising those hormones. That's why people who take them have this false sense of extreme well-being. I want to be very careful. False senses, we call it euphoric feeling. So it gives them that sense. So the brain is desperate, looking for any means that will raise the happy hormones. So if you take alcohol or substances when you are stressed, and this point is very important, chances of you being addicted are higher than someone who takes it when they are happy and not in stress, because you are feeding a vulnerable brain that will learn that this is how I derive happiness. So in other words, it will be a way of medicating yourself to temporarily elevate the happy hormones, and that makes people hooked. So as a point, it is very important for people to know and be cautious that in the circumstances of extreme stress, avoid use of substances or alcohol, because the chances of you being hooked or addicted are higher than if you took them when you are happy or occasionally with people. So that is a very important point that I wanted to make.
Thank you so much. I know our time is fast spent, but I think it's also important to go through a few comments that have come through. Interestingly, someone said, I was busy taking my cup of coffee while enjoying this program, and the moment you talked about coffee, I rushed to pour down my tea, you can imagine. Well, there's also someone, thank you so much for the show. I realized that prioritizing my mental health is better than the money we are looking for. If we talk about sleep as one of the causes of mental illnesses, then the entire Uganda will suffer because it will nnyo. Thank you so much for the show. Thank you so much, Doctor, for highlighting these causes. Thank you so much. But sometimes even when you seek counseling, it is temporarily, so it doesn't go. What then happens? So I see people are concerned and they're affected, especially someone who says that they are having their tea. But I know we cannot go beyond this point. However, we shall find time, we promise, to come back and talk about more about mental health, and of course, what we've not talked about here, and perhaps responding to some of these questions. We shall gather all of them. Now, I permitted you to add in, keep sending more and more and more. We shall arrange another unique show to come and respond to some of these questions and concerns that have not been talked about. Otherwise, we appreciate and thank you so much for watching Family Hour, today's episode. Edrine Austin Mkalazi is my name. I've worked with Naya Junior and Muhumuza in transmission. From the 13, wish you a blessed night.
Family Hour, empowering families one episode at a time. Together, we build strong, healthy, and thriving families with our daily dose of inspiration and expert insights on topics that matter, like education and career growth.
God did not give the white people or the black people less talents. No. By the time God said, go and take control, that means God, our Father,